root component of your breath. Maybe the first 10-15% of your breath, you want to root your breath, right? So you send your breath down as if you're trying to almost like to pee, but you hold it. So you go down there. Then comes the full belly, right? The abdominal breathing, where you're just expanding the abdomen, relaxing the digestion, triggering the parasympathetic nervous system. And then before you go to the chest, there's the ribs. And this is a lateral expansion. It goes out, right? You're trying to like push out the ribs. And then comes the chest, where you are lifting up and front. The chest is the presence, and you fill air into the tips of the lungs that usually don't get much oxygen. So look, if you put one hand underneath your belly button, okay, and then one hand on the main abdomen, and try to get that first chamber. So you inhale and try not to move the upper hand, just the lower. Feel like pressure comes underneath that hand, and then expand the belly, and then exhale. Just work a couple of cycles just with that. So push the air into your root, and then expand the belly, and then exhale. Root, belly. If you're feeling very agitated or ungrounded or emotional, this is the breath to practice, these first two chambers. Root your breath is going to help to root your mental state. Then comes the ribs, right? The ribs is a little tricky. So put your hands on the sides, elbows out, and push. Try to expand out your ribs, pushing the hands out to the sides. You have to will those intercostals. They're not that used to working deliberately. And then exhale and push the hands back into the center. Push out the hands to the side. And in. Just try to isolate that one. This is a more tricky chamber to feel, right? So the belly is not working, the chest is not working, it's just this lateral edge. Okay, this is for that side and lower part of the lung. And it's your connection between the abdomen and the chest. And then the chest is the easiest in general, right? Unless you're someone who has a lot of, kind of more weak or uncertainty, or you having a bit of feeling a little blue, a little depressed, so then the chest doesn't want to move, right? Feels constricted and heavy. So you lift it up and forward. Up and forward, that's the chest. Send the energy up. And so working with the breath in this chamber gives you a more of an uplift of awareness and mood. All right, let's do one where let's try to see if we can get all four chambers. So the best would be to put a hand here and a hand on the side. And so let's start. Root, belly, side ribs, chest. And then let everything relax. And repeat. Root is 10 to 15%. Keep going. Belly is maybe 60%, 10% for the ribs, and the rest in the chest. Okay, so the abdomen is the main part. Okay, you keep working, do a couple more cycles. And we breathe about 15 times per minute, 20,000 times per day. 20,000 times per day, everybody. Do your math. How many times you do this? The main breathing muscles, okay? We have the diaphragm and the intercostals, the main inhaling muscles. Because when we inhale, we expand the lungs out. That's the active part. Okay, and the accessory muscles. I want to show you a couple of diagrams because it's always interesting. Look at the diaphragm here. The diaphragm is, and as I tell you about this, keep working with your breath in your own privacy. So the diaphragm is really a dome. See how incredible. And below is all the belly muscles, organs, and above it is the lungs. But see how the size of that diaphragm muscle. And see how when we really use diaphragmatic breathing, we really massage in all the abdominal muscles, the abdominal organs, because that dome gets flat, pushes down, and so the lungs expand and the abdominal space contracts, and so all the liver and the stomach and intestines get a very nice massage 20,000 times per day. These are the accessory muscles, meaning that they come into play when we are actually doing a more fulsome breath, as I'm explaining to you in the 4 chambers. The pec muscle, up here, this is called the scaling muscle, and the trapezius. Those happen when you're trying to really get air in the top of the lungs, and we really want to try to engage these guys because the top of the lungs doesn't typically get renewed. It gets very stagnant. And then we have all the obliques and the abdominal muscles. Those we use them especially to enhance the exhalation. When we push air out, we are using these muscles down here. And the intercostal muscles, here they work in both the inhale and the exhale between each of the ribs. Here, just for you to see how the left lung, and most of you know this, has only 2 lobes, and the right has 3. Why? Because on the left, in the same space, we have this other friend here, which is the heart. So the heart occupies space, and to the expense of the left lung. So we always want to be making sure that we are consciously sending air to the left lung, okay? Left lung. Here there's an image of a real lung, just for you to get a visual feel for it. This is actually a non-smoker's lung. A smoker's lung will actually look black or full of black dots. And this nice pink, I mean, this is not the actual regular texture of a lung. This is because it's been treated with probably formaldehyde, a chemical to preserve it. The actual tissue of the lung, if you touch it live, and I have had the opportunity to be part in a chest surgeries where I could actually feel with my hand a live lung, and it's completely soft and spongy and shiny and pink, ideally. That's how the actual lung looks like. And this is the incredible universe of the, see on the yellow one, this is all the airway, okay? The bronchi coming up and then dividing on the right side here, the right lung. And look at the incredible network of airways coming smaller and smaller and smaller every time. On the left side, you see the same thing, but the relationship with the vessels, with the blood. See, they're completely intertwined. Air and blood completely intertwined in our lungs. How much air? So just, this is an interesting thing to have a sense of. Okay, the total capacity in our lungs is 6 liters. 6 liters, 6,000 milliliters. Now, out of those 6,000, when we are breathing normally, a regular breath, we only exchange 500, 12 times less. That's if we are breathing without thinking about it. Now, let's say you finish exhaling in your regular breath and you want to push air out more, right? You use all those abdominal muscles. You're going to be able to push out another 1,200, another liter and 200 milliliters. That's the reserve exhalation volume. Now, let's say you want to actually have a full inhale, right? Full deep inhale. Look how much. You can inhale an additional 3 liters besides the 500. So the vital capacity is actually the full extent of a breath. Now, from the 6,000 milliliters, even if we did maximum, we could never exchange with the air the 6 liters. We could never do that. There's always a volume of air that will always stay in the lung. Call that our life insurance. We come into the world in that first breath at birth, and we inhale, right? And then we keep a deposit of air all our life, 1,200 milliliters. It never exchanges. And then at the moment of exit, we give it back to the universe. That last exhale, the goodbye for the physical form, comes with that reserve volume being pushed out. In between, just keep this awareness. In a regular breath, half a liter. But in a full vital capacity, we could exchange almost 5 liters, 10 times more. That's how much we could exercise our breathing. And a fuller breath will have all the physiological and the perceptual impact that we talked about. All right.
Okay, so thank you, and that's wonderful to have that awareness of that capacity of the breath, and I felt this connection to this 2-1 breath, because what we call the 2-1 breath, the focus is actually on the exhale, and as a result, then the inhale also becomes deeper. And actually, this breath, which focuses on a very long, deep exhalation, is related to, I was mentioning, like through my experience in music therapy and working also in the medical setting in music therapy, I have found that this breath that focuses on a long and deep exhale is very helpful in cases where people are overwhelmed, very extremely anxious, and even have suffered traumatic events. So, for example, working at the Beth Israel Hospital, I was working with people who were patients pre and post surgery. And what I found is that, and it was usually after an accident, they were hospitalized and had to go to surgery. So what I found is that the accident, having had an accident,